Hi, I am Dr. Surekha Tiwari. I'm a practicing homeopath and a practicing counsellor. I have patients in Bangalore where I have 2 clinics, and I have patients outside Bangalore too. It's been a beautiful journey with homeopathy and psychological counselling. Leucoderma and vitiligo, they're often used together, but they are not the same. Leucoderma literally means white skin. So white skin can result even from a cut, from a burn, from an injury. What has happened is, in that localized area, because there was a destruction and repair of cells, so the melanin containing cells were not able to function normally because there was a disruption. This literally is what leucoderma is. Vitiligo, on the other hand, it's an autoimmune disorder. Autoimmunity comes from extreme stress. It can be genetic. It can be when there is a life-changing situation. And vitiligo is generally where it's a sudden appearance. And whereas very specific areas where vitiligo shows itself the first, around the mouth, around your genitals, where the inside of the body and the outside of the body are most susceptible, where they're meeting. All these things you will see vitiligo. Leucoderma generally it has a long course. Leucoderma will not be appearing very suddenly. It will be related to a certain event. So you will have some white patches. It could even be a toxin applied on the skin, environment with having some toxin which can create leucoderma. So leucoderma will have some cause in the life or the environment. Vitiligo will have more cause in extreme stress, life-saving situations, genetic predisposition, and all those things. So surprisingly, because vitiligo is an autoimmune disorder, and if the stress or the immunity quietens down, then vitiligo can often recover completely. Now, these are the cases where we see that the white patches just disappear after some time. Leucoderma, on the other hand, once it has happened, it will take at least 2 to 10 years for it to gradually may or may not progress. And even if it progresses, the progress will be very, very ill-defined. You will not be able to locate where it's coming. Vitiligo will have a pattern of appearance and disappearance. And in both the cases, we've always seen a little exposure to mild sun. Mild sun, the early morning sun, not in the late evening, early morning sun is the best. A mild sun exposure in the morning helps the UV radiation bring out your melanin pigment. Also, to a large extent, a little degree of maintaining a good quality diet, in which you need to be taking some amount of fat, because melanin is a fat soluble pigment, and that is why you see when you apply oil, your patches look a little duller. And generally the use of proteins in both the conditions is very good. In homeopathy, for vitiligo, you can go to homeopath with almost an 80-90% chances of recovery, because the case taking in homeopathy will help you with individualization and quietening your autoimmunity. For vitiligo also there is help available, but for vitiligo sheer patience helps a lot, and also the topical care of your skin. Get some help in homeopathy through a lot of liver medication which helps you discharge more melanin. But in both the conditions, there is a medicine in homeopathy which is known as arsenic sulf. It helps very well. But I would still recommend go to a qualified homeopath, ask for his opinion, and take the correct medicines. There is enough help.